Hi, I am Andres. She is Elizabeth.
Hello, I'm Elizabeth, and today we are going to talk about a clinical case, and the disease is cystic fibrosis.
Hello, people. Today we are going to talk about a clinical case. So, our objective is to describe the clinical case and show possible treatment. Cystic fibrosis is a genetic disease present worldwide. This is a multi-system disease of chronic, progressive, and lethal evolution. Cardinal manifestations include chronic obstructive pulmonary disease, exocrine pancreatic insufficiency, and elevated seed electrolyte concentration. In more than half of the patients, the diagnosis is suspected by the presence of respiratory symptoms. Bronchiectasis is the end result of different diseases that have common main point. It could develop from an infection or a medical disorder, such as pneumonia and cystic fibrosis.
Okay, now I'm going to present a clinical case. An 18-year-old boy had a history of repeat chest infections. He had problems with a cough and sputum production in the first 2 years of life and was labeled as bronchitis. Over the next 14 years, he was often chesty and had spent 4 or 5 weeks a year away from school. Over the past 2 years, he has developed more problems and was admitted to hospital on 3 occasions with cough and purulent sputum. On the first 2 occasions, Haemophilus influenzae was grown, and on the last 2 occasions, 2 months previously, Pseudomonas aeruginosa was isolated from the sputum. He is still coughing, and although he has largely recovered from the infection, his mother is worried and asks for a further sputum to be sent off. The report has come back from the microbiology laboratory, showing that there is a scanty growth of Pseudomonas on culture of the sputum. There is no family history of any chest disease. On examination, the patient is thin. The weight is 48 and 1.6 m in tall. The only finding in the chest is of a few inspiration crackles over the upper zones of both lungs. Cardiovascular and abdominal examination is normal. The chest X-ray shows abnormal shouldering through both lungs. Cystic fibrosis should always be considered when there is a history of repeated chest infections in a young person.
Conclusion, unfortunately, there is no cure for cystic fibrosis, but there are many treatments that can relieve symptoms and reduce complications. The goal of treatment includes the following: prevent and control infection, remove and soften the mucus of the lung, treat and prevent intestinal obstruction. Medication included antibiotic and bronchodilator. So this young boy can feel better with this treatment, and in later stage lung transplantation can be considered.
Thank you for your attention. We hope you understand.
Thank you.